Azam, who's a National Officer for Health at the GMB.
Good evening, everybody. Huge thanks to the People's Assembly for organising this rally this evening. Tonight, as we unite, we must promise that whatever the government throws at us, we are united in defending our NHS. Solidarity greetings from the GMB members to each and every junior doctor who's joined the fight for our great NHS institution. Solidarity with each and every junior doctor's family and friends who've joined the fight to protect the beating heart of our NHS, the brilliant NHS staff. We fought hard to kill the Health and Social Care Act before 2012, the act that relinquished the government's responsibility to provide health care. We fought hard to kill Section 75, which denied the right to prioritise NHS providers over the private sector. We fought hard against Clause 119, which reinstated the government's power, but only to close and asset-strip hospitals, power without responsibility. We've marched hundreds of miles to bring attention to the effects of the Act. Some battles we have won, others we have lost, but the fight the government has picked with the NHS staff is one we all have to win. 4 years ago, GMB members in the ambulance service were faced with an imposition similar to which the junior doctors are facing today. In the GMB, we organised our members, we strengthened our voice, and we challenged employers who imposed cuts to our unsociable hours for members who dared to take sick leave. We organised an industrial action ballot, we began organising strike action dates, and we began organising our legal defence. And you know what? The employers suspended their imposition, the employers suspended cuts to our pay, and the employers actually paid back the cuts they made. We got round the table and we agreed a negotiated outcome that was accepted by all parties. And it's because of successes like this that the trade union bill is now flapping its way through Parliament. A Tory bill that attempts to silence our voice at work. A Tory bill that wants to stop NHS staff and public sector workers standing up for patients and defending services. A Tory bill that attempts to stop our democratic human right to withdraw our labour when the bosses are trying to cut services and wearing workers down. In the GMB, members always lead the way. My job is to make sure GMB members have all the tools at their disposal to support them in their efforts to win at work. But we can only do this if we have a strong union presence in the NHS. It's the only way we are going to win. After all, if we win for workers, we win for the public and we win for everyone. Junior doctors have done the hard part. Junior doctors have almost managed to unite all NHS staff together. Junior doctors have managed to unite an army of public supporters. Now, junior doctors need to be strong in their resolve, and we've heard it tonight, in standing up for patients, keeping their union strength, keep building solidarity and keep fighting. And we need to convert the enthusiasm, the spirit, the grit of these rallies in organising our hospitals, our GP surgeries, our ambulance stations, our mental health community and NHS trusts. We have to take our fight to our hospital wards, our surgeries, our ambulance stations and hospitals, and we have to organise the thousands who have not joined a trade union and ask them to join. And we've got to make sure that the unions lead the charge in representing their members at work. And finally, just to conclude, I've been asked to read a short message from the European Trade Union, and it reads, "We bring you the solidarity of junior doctors, nurses and public service workers from EPSU, Europe's Trade Union Federation for Health and Public Service Workers in Europe. Their 8 million voices support your fight.